Hey there, what's up everybody? This is your nutritionist on the go, KANWALDEEP AUJLA from Erudite Nutrition, and it is time that we start discussing about the diet protocols of a COVID-19 patient. These videos are specifically made for those people who are suffering from COVID-19 infection, who are right now suffering from the infection. Either they are home quarantine or they're having their home treatment, or even if they are admitted in a hospital. This video is not for someone who has not contracted the virus yet. Okay, so in this video we will be talking a lot about the recovery of a patient after contracting with COVID-19 virus. We will also make a different video of how you can strengthen up your system, but you probably have known about how to increase your immunity through the thousands of blogs that you have read till now on the internet. So we will be going into that part later, but right now the important is that there is a massive wave all around the nation. People are getting infected, people do not find hospital beds, and when they do find hospital beds, they do not get proper treatment, and when they do get proper treatment, they are not given a proper diet that is compatible, that is helpful to them in their disease. So that is where I come in. So to watch this whole playlist, you have to start from this video and continue watching the upcoming videos of the playlist. So stay tuned. Before talking about what COVID-19 patient has to eat, we have to make a general understanding of what happens in a COVID-19 patient. See, there are wide range of symptoms, from fever to general cough and cold looking like symptoms to diarrhea or gastritis, body aches, body pain, skin rashes, muscle pain, joint pain. Out of all of these symptoms, the one that actually stands out, which is the most dangerous one and which is the leading cause of mortality in a COVID-19 patient, is the respiratory failure of the patient. We call it viral pneumonia. Some doctors prefer it saying acquired pneumonia, but both the terms are good with me. It is a type of a pneumonia after you have contracted the virus, and the virus creates all this disturbance in your body. So what actually happens? So before that, let's focus on, I have made a diagram of a lung diagram. Okay, so this is the right side of the lung, this is the left lobes of the lung. These red colored lines that you are seeing right here, and this one line right here, this actually shows the different lobes of our lungs. So the right lung has 3 different lobes, and the left side of the lung, this is where the heart is positioned at. Okay, so the left side has 2 lobes, the right side has 3 lobes. We will be discussing about the lobes in this video later. On the right side, I have shown a general diagram of our lungs, that how this trachea divides and branches into bronchus and bronchioles, and further these green colored structures that you are seeing, these are the alveoli. These are the air sacs that actually take the oxygen from the air that we have just breathed in and dissolve it into our blood. So these are the main factories of diffusion, I should say. They dissolve the oxygen that we have breathed in into our blood, and that is how we maintain a saturation of oxygen in our blood. So people nowadays are complaining of shortness of breath and hypoxia, that is the decrease in the oxygen levels, the decrease in the saturation level of the person that is suffering from COVID-19. So basically it is linked with these structures called alveoli. Okay, these are the main structural components that are responsible for diffusion of oxygen in our blood. So coming back, what actually happens when a person is infected with this SARS-CoV-2 or the COVID-19 virus? So these are the steps. These are the worst steps that anybody can have. Before I start discussing it, the last year I made a few videos on COVID-19. In those videos I clearly stated that 80% of the people are not going to have severe symptoms. But the huge massive number of people falling sick, and those are hospitalized, and we also have seen huge numbers in mortality, is because India is a densely populated country. So the number of people being infected is so much. Still, majority of the people are getting home medication or home isolation, and they are pretty fine with that. Even in the hospitals, majority of the hospitals are maintaining a good recovery rate of the COVID patients, but those unfortunate few who aren't able to be managed with medicines or are not brought into the hospitals on time, they have to suffer severe consequences. So what happens in a COVID-19 infection is, so in the starting, you come in contact with a person and you get infected. This can happen to people who are helping or giving care or providing medical service, or even if your family member is sick, a person who is providing care to the sick person, these are the people who are coming in contact. Why are these coming in contact? Because we are unable to maintain proper social distancing, we are not wearing masks, we are not taking precautionary measures, we are not sanitizing our environment and ourselves enough. So once you get infected, in a few days, the virus will start to incubate. This will be a period of about 2 to 4 to 6 days. The virus is going to hijack the system of your own body. It is going to hijack your cells and start replicating itself. A virus does not have its own replication mechanism, so it hijacks one cell of the host body, replicates, and then further distributes that virus into another different cell so that can be further replicated. So this is the incubation period. After the incubation period, the person will start building up some form of immune response. This can be a fever, a cough, or a rash in the throat, or some kind of a skin rash, or any immune response that your body is creating when this virus is detected in your body. So sneezing, coughing, mucus thickening, chest congestion, all these are forms of inflammatory response that your body is creating against this virus. So these are the early signs. If you are having an early signs, don't feel shy. Get yourself tested right away and start your precautionary medicine. Consult with your doctor, and if your tests do come positive, unfortunately, then start the COVID-19 medical protocol. So after this immune response, the inflammation in your body is going to increase. So how is this inflammation detected? There can be a blood test done that is called CRP, that is C-reactive protein. It is an inflammatory marker. The another blood test done is interleukin 6. Interleukin 6 is also an inflammatory marker, so your doctor is going to prescribe you these blood tests. The reports will come in, and if the level of CRP is high or the interleukin 6 levels are high, that means your body has high levels of inflammation in your body. This inflammation is going to translate into this acquired pneumonia. Now, how is that going to happen? So basically, when your body is detecting the virus component in your body, the COVID-19 virus in your body, it will send the immune response, the white blood cells, on spot to kill this COVID-19 virus. But what is going to happen is the hyperactive response of your own immune system is going to damage your lungs. So let's bring our attention towards the diagram. This side of the lungs, I have just shown the basic structure, but on that side of the lungs, I have shown different type of shapes, and I will be explaining them in a minute. So what happens is, the virus infects your lung cells. The white blood cells detect these infectious foreign particles, and they give an immune response. In that immune response, it starts killing off all the cells of your lung tissue or your body which are infected with COVID-19 virus. But since you are way past the incubation period, now the virus has hijacked a very high number of your own body cells for its own replication. So your immune system triggers up, calls for all sorts of help and measures that it can get, and it starts destroying all the host cells, all those cells that have been affected with this COVID-19 virus. When our own immune system is going to kill off those cells, the debris, the cellular waste of those cells will release some fluid, and also body will also send in some amount of excess fluids so that more amount of white blood cells and lymphocytes can be brought into action. This will actually start creating a pneumonia-like issue. So if you look at the left side of the lung, See, actually, this is the stage when we get our HRCT, that is high resolution computer tomography done. HRCT chest is being done. And I have said that there are 5 lobes of our lungs. So every lobe is given a scoring out of 5. Okay, if you have seen somebody's HRCT report, the report ends with a chest severity score, which is out of 25. The higher the score, the more amount of damage has been done to the lungs. So every lobe of our lung will be rated out of 5 points. More the damage, the more points will be given to that particular lobe. And in the total, the severity score will be mentioned from all those lobes combined. So what kind of effects do we see when a COVID-19 virus creates this acquired pneumonia in our body? So the number one is the one in the green color that I have shown. This is GGOs, that is ground glass opacities. That means there has been some section of your lung tissue which has fluid in it instead of air. So we know that alveoli are the ones responsible, the structures that are responsible for air exchange. But if in place of air there is fluid in our lung cavity, that is going to decrease the efficiency of gas exchange of our lungs. So there will be this ground glass opacities, sections of your lung that will be looking like a hazy, cloudy glass mirror, which will be shown in your HRCT report. The second I have shown in red color, I have written the short form. This is subpleural atelectasis. What is subpleural atelectasis? That means these are some type of lesions or a part of your lung or the tissue of your lung in that particular section has collapsed. Now, since it has collapsed, it is no more functional, further decreasing the oxygen diffusing capacity of your lungs. So these are the reasons why the oxygen level of a COVID patient falls down below normal standards. The third, that is pleural effusion, that I have shown in this blue color. It is the filling up of lungs with pleural fluids. So I have talked about the excess fluid that our body sends, so that more amount of white blood cells and leukocytes and lymphocytes reach the site of infection, and all that debris and cell death that is occurring because of the virus, all these fluids start accumulating in your chest cavity. The body is trying to remove this fluid by itself, but the rate of fluid taken out from the lungs is very slow, whereas the fluid rushing in is at a higher rate. So we will start seeing pleural effusion in either one or most probably in both the lungs. So when fluid will start filling in your lungs, we can see that if the fluid is filled up to this mark, then all these alveoli are now submerged in fluid. Now these alveoli cannot perform a gas exchanging function when they are submerged in fluid. So these factors, the ground glass opacities, the subpleural atelectasis and pleural effusion, are the primary cause of respiratory failure. So a higher inflammatory response triggered the pneumonia-like issues, and further this pneumonia caused fall in the saturation, which created an excess amount of stress on your respiratory system and on your cardiac system, ultimately leading it to failure and unfortunately an untimely demise of the person who is sick from COVID-19. So this is a general mechanism of how a COVID-19 virus is killing so many people or harming so many or making permanent damage to the lung tissue of so many people. So these subpleural atelectasis or the ground glass opacities might never be fully recovered even after the virus is put in remission and the person is out of the hospital and now he's at his home. Even after a couple of months or even years, some amount of fibrosis, that is scar tissue, will develop in your lungs that is permanently going to decrease the actual lung capacity of your So guys, body. This is how a COVID-19 virus is causing this huge havoc in our nation and has collapsed the government and the medical system. But still, hats off to all those medical professionals who are fighting in and day out. My salute to all the medical workers, all the doctors and all the nursing staff and everybody that is putting in their contribution to save people's life. In the next video, we are going to talk about these symptoms and the diet which will help us alleviate these symptoms or decrease the harmful effect of these symptoms and will help us in our path to recovery. So stay to the channel, subscribe to my channel, follow me on Facebook, follow me on Instagram. You can DM me if you do require help in treating your COVID patient. So signing off now, I'll see you guys next time. Until then, take care.